My biggest hobby is sailing. I love that it is calming. You just simply have the wind, the waves, the sun. To harness that and to sail, it just is a stress reliever. My name is Kevin, and I have active psoriatic arthritis. I was first experiencing skin symptoms about 35 years ago and was diagnosed at that time with psoriasis. I noticed the plaques in my hair. I had hair back then, just spread. So I would have it on my legs, thighs, my torso, front, back, my arms, basically all over. It was hard dealing with it because it was an outward skin condition that was, frankly speaking, not pretty to look at. And so I was very self-conscious about it. And not only was it not visibly nice to look at, it would crack and bleed. I started noticing psoriatic arthritis symptoms about 20 years after my psoriasis diagnosis. It happened when my son was born. I was wanting to play on the floor with him and noticed that my knees were hurting, my joints were hurting. The skin condition was bad enough, and now it was like, good grief. My doctor described psoriatic arthritis as a chronic condition, inflammation of the joints, a condition that I would most likely have for the rest of my life. And so that's why I took the initiative to talk to my doctor about it, to find a way to actively treat it so I could learn to live with it. It was important to find a treatment plan that worked for both my skin symptoms as well as the joint pain because the two conditions are related. I was prescribed Skyrizi after exploring some other treatments. Skyrizi helps me move with less joint pain and stiffness. I'm able to hoist the mainsail, tie the knots. I'm able to sail. I love that. I've reached 90% clearance. My doctor was very pleased with the results. I'd like to tell my story because I want people to know that even if you have the condition of psoriasis or psoriatic arthritis, it's not the end of an enjoyable life. I have psoriasis, I have psoriatic arthritis, but it doesn't have me.
Important safety information and use. Skyrizi, risankizumab-rzaa use. Skyrizi is a prescription medicine used to treat adults with active psoriatic arthritis, PSA. Important safety information. What is the most important information I should know about Skyrizi, risankizumab-rzaa? Skyrizi is a prescription medicine that may cause serious side effects, including serious allergic reactions. Stop using Skyrizi and get emergency medical help right away if you get any of the following symptoms of a serious allergic reaction: fainting, dizziness, feeling lightheaded, low blood pressure, swelling of your face, eyelids, lips, mouth, tongue, or throat, trouble breathing or throat tightness, chest tightness, skin rash, hives, itching. Infections. Skyrizi may lower the ability of your immune system to fight infections and may increase your risk of infections. Your healthcare provider should check you for infections and tuberculosis, TB, before starting treatment with Skyrizi and may treat you for TB before you begin treatment with Skyrizi if you have a history of TB or have active TB. Your healthcare provider should watch you closely for signs and symptoms of TB during and after treatment with Skyrizi. Tell your healthcare provider right away if you have an infection or have symptoms of an infection, including fever, sweats, or chills, cough, shortness of breath, blood in your mucus, phlegm, muscle aches, warm, red, or painful skin or sores on your body different from your psoriasis, weight loss, diarrhea or stomach pain, burning when you urinate or urinating more often than normal. Do not use Skyrizi if you are allergic to risankizumab-rzaa or any of the ingredients in Skyrizi. See the medication guide or consumer brief summary for a complete list of ingredients. Before using Skyrizi, tell your healthcare provider about all of your medical conditions, including if you have any of the conditions or symptoms listed in the section, "What is the most important information I should know about Skyrizi?" Have an infection that does not go away or that keeps coming back. Have TB or have been in close contact with someone with TB. Have recently received or are scheduled to receive an immunization, vaccine. Medications that interact with the immune system may increase your risk of getting an infection after receiving live vaccines. You should avoid receiving live vaccines right before, during, or right after treatment with Skyrizi. Tell your healthcare provider that you are taking Skyrizi before receiving a vaccine. Are pregnant or plan to become pregnant. It is not known if Skyrizi can harm your unborn baby. Are breastfeeding or plan to breastfeed. It is not known if Skyrizi passes into your breast milk. Become pregnant while taking Skyrizi. You are encouraged to enroll in the pregnancy registry, which is used to collect information about the health of you and your baby. Talk to your healthcare provider or call 1-877-302-2161 to enroll in this registry. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. What are the possible side effects of Skyrizi? Skyrizi may cause serious side effects. See, what is the most important information I should know about Skyrizi? The most common side effects of Skyrizi in people treated for plaque psoriasis and psoriatic arthritis include upper respiratory infections, headache, feeling tired, injection site reactions, and fungal skin infections. These are not all the possible side effects of Skyrizi. Call your doctor for medical advice about side effects. Use Skyrizi exactly as your healthcare provider tells you to use it. Skyrizi is available in a 150 mg per milliliter pre-filled syringe and pen. Please see the full prescribing information, including the medication guide for Skyrizi.